A few thoughts on medicine, philosophy, and meaning. The topic that I would like to discuss today is about Helicobacter pylori infection. This infection, some people consider it as a foe, some people consider it as a friend, or some people consider it as a roommate. This is one of the most common chronic infections on earth. It is estimated that almost 50% of the world population harboring this infection at one point of time. This rate could be lower in developed countries such as the United States, which is almost 20% of population. The overwhelming majority of people who have this infection are asymptomatic. But at the same time, this infection can create inflammation in the stomach and lead to gastric or duodenal ulcer, multilymphoma, dyspepsia, or gastric cancer. This is why World Health Organization considers this infection as #1 carcinogen in the world. The relationship of this infection and body could be complex. We see that in part of the world that the prevalence of this infection is high, the rate of GERD is very low, and vice versa. And it is not uncommon that we see GERD symptoms right after eradication of this bacteria in those who are asymptomatic. This does not mean we should not treat Helicobacter pylori. And every time that we see this infection, we need to treat this infection properly. Unfortunately, due to high rate of bacterial resistance, the treatment of this infection could be difficult. The current treatment of this infection involves using 4 simultaneous antibiotics. And it's ironic that antacid in the form of proton pump inhibitor could be considered one of the antibacterial in treatment of this infection. One of the misconceptions in treatment of this infection is as soon as patient receives the antibiotic and symptoms are resolved, patient would not check for eradication of this infection. This is necessary step that should be done 3 to 6 months after eradication of this infection to ensure the bacteria is gone. In addition, we always suggest that family member of the individual who have infection in the stomach be checked, and if they have infection, they need to be treated as well. In some cases, due to high resistance of this infection to antibiotic, the treatment does not result in eradication of bacteria despite receiving multiple courses of antibiotic. And in these cases, maybe the observation is the best strategy to follow at the present time. These are the take-home messages for this infection. H. pylori is a very common chronic infection, and in overwhelming majority is asymptomatic. But since it doesn't cause symptoms, doesn't mean it doesn't need treatment. This infection can create chronic inflammation in the stomach, result in ulceration in the stomach and duodenum, or even result in cancer. Therefore, it needs to be treated properly, and also it needs to be checked that the bacteria is gone after proper treatment. In addition, the family member of those who have infection, they need to be checked and treated properly if they have the infection. In very rare situation that the bacteria is completely resistant to multiple courses of antibiotic, the best strategy would be observation till we have future proper antibiotic to treat this infection.